Before you guys start my timer, can we give a huge round of applause to the Catalyst team and to Capital Factory for having us here today? Good afternoon, everyone. My name is Ishan Sheth, and I, alongside my fellow student associates, Siva and Advait, have had the privilege of working with the Suture team through this Catalyst cycle. Over the course of the mentorship phase, our team supported the business and regulatory aspects of the product's development. We first collaborated with Discovery to Impact to build a rock-solid IP protection plan for the device and its software. Our team then devised a meticulous path-to-market plan, complete with a detailed approach to generate significant revenue and a plethora of expansion opportunities. We as associates had the opportunity to be integrated into a design team at the heart of healthcare innovation. And in return, we provided utility to Suture through the business sense and knowledge gained during the Texas Health Catalyst boot camps. We want to give a huge thank you to our mentors, Ms. Nancy Patterson and Mr. Trevor Lind, as well as Ms. Corey Lago and the rest of the DTI team for their guidance and support throughout this process. As an associate team, we're incredibly grateful for this opportunity, and we've learned so much over the course of this cycle. Now here's Dr. Charles Fraser, the project lead for Suture.
Thank you very much. I'm just representing some much smarter and more impressive graduate and undergraduate students that I'm fortunate to get to work for on this Suture project. I'm Charlie Fraser. I'm a heart surgeon at Dell Children's and Dell Med faculty, and it's a privilege to present here. So these are the typical patients we take care of at our heart center. This is a 4-pound baby with detransposition of the great arteries, universally fatal without open heart surgery in the first week of life. The video on the left shows us performing an arterial switch procedure. Now, if I were to tell you that to do this, it takes 4 years of medical school, and then over a decade of training, you'd probably say, well, that makes sense, because that looks kind of hard. But what if I also told you that during that 15 years, I never had any form of objective quantification of my ability to do this? So no haptic feedback training, no real simulation, no one telling me, hey, this device is telling me you may be a little too rough with this tissue. I think most of us would be a little concerned to have their baby operated on by someone like that, but that's every single heart surgeon in the world. So this is the market. There isn't a pediatric cardiac surgery training simulator that exists, but think bigger. There isn't a simulator that exists to give haptic feedback for any delicate open operation that we do. I say open because we've skipped over and we've addressed this problem in minimally invasive surgery like robotics with Dr. Coker, laparoscopic surgery and endoscopic surgery, but somehow we've skipped delicate microscopic tissue handling in our surgical education world. So we think that this applies to over 1,000 surgical training programs with more than 10,000 annual trainees nationwide. Suture is our solution. It's a next generation haptic enabled surgical training system that replicates the tactile experience of highly technical procedures, in our case, pediatric heart surgery. We utilize tool tissue forces to give instant feedback. We filed a provisional patent for this, and we feel like this could be expanded to any instrument to really lead the world of advanced surgical simulation. Our path to market, well, this market exists. Surgical simulation is a $1.8 billion industry with a significant annual growth rate, but we want to market to the already existent surgical simulation centers, the American Boards of Surgery, to make this the gold standard in surgical training. As I've said, we feel like there's a market beyond cardiac surgery. That's just kind of our proof of concept, but this applies to plastic surgery, abdominal surgery, transplant surgery, vascular surgery, thousands of trainees across the country. And then there are other applications that we're starting to look into for AI and robotic applications to our technology. And our ultimate goal is, just like laparoscopic and endoscopic surgery, for this to become a mandatory component of the training that I finished, so that someone is giving you objective feedback in how you can do and if you should even be doing these operations. I work with a remarkable group of people. We hope to utilize the resources here to move ahead with our pilot studies in heart surgery, and then hope to provide proof of concept for future specialties. Thank you.
Thanks so much for the presentation. You mentioned that there's not currently a feedback mechanism on how delicate you should be. So how do you get that baseline information to train the suture model?
Yeah, so our pilot study is going to be to use our device and we use our model with our surgical faculty to perform the procedures on the model to develop benchmarks for, standard practice. We have multiple senior surgeons here and have them do repetitive procedures with our model to develop baselines and then apply those to trainees and hopefully in our programs here to then go ahead.
Super quick question.
Sure.
Is your model static or changeable for different types of people's hearts or whatever
Well, we
you're working
3D print hearts all the time for surgical planning, so we have the capability to do that. Right now, we have a more basic heart surgery procedure model, but I use 3D printed hearts all the time for surgical planning, so we have the ability to apply it to any defect.
Yeah, thank you. That's a follow-up to that question. A lot of what depends on the amount of attention you want to put is the actual tissue properties. So can you use your device on in an animal lab or something where there's
Yeah.
actually live tissue? Is it the instrument itself measuring it, or
It's an
tissue?
attachment to the instrument, so it can actually be fixed to any instrument that's used in anything. So I could bring my own instruments and attach our device onto it.
So it could be used actually in the operating room as well, or no?
Technically, but that would introduce a lot of sterility concerns, and also the other thing that's on the slide but I didn't mention is this doesn't require FDA approval because we're using it in training purposes, so that would bring the FDA into it if we were to use it in that way.